Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. He is on the front lines
While
here
the state
in the
is
U.S.
under another public health emergency due to a surge in COVID-19 cases.
COVID-19 Delta variant, it's gaining speed around the country and right here in
forecast for Arkansas paints a picture of a raging forest fire that is likely to grow.
Well, with the latest uptick in COVID-19 cases, Arkansas churches are changing their COVID rules to limit the spread of the virus.
We felt like the risk of the congregation when we began to follow it was pretty high.
For the staff, we started making plans on how to continue to do our work and not be a threat to one another.
Conference calls are not the norms as far as doing worship service.
When it comes to the place of worship, there was a sit down, come to Jesus moment. Because here, we fellowship, we come among each other, we praise God, we raise our hands, we shout, we say amen. There was the risk because as the information came how the virus was transmitted, cut all of that out.
Kenesha Bryant Moore. I am the Assistant Dean for Diversity, Equity, and Inclusion at the University of Arkansas for Medical Sciences, College of Public Health. So I've been here at UAMS for about a little over 12 years now. And I initially was in the College of Nursing, and then now I'm in the College of Public Health and been there for about 5 years. And a lot of my research involves the faith community, and I've been doing that since I've been in Arkansas. Initially we started in the Arkansas Delta region, and now kind of doing work across the state. So the Faith Network is actually stands for Faith Academic Initiatives for Transforming Health. And we were established in 2016. We received some funding from PCORI, which is the Patient-Centered Outcomes Research Institute, to actually establish the network. And really the goal was to, one, increase the number of faith leaders that knew about research, can be engaged in research, and be active, just not participants, but actually partners in research. There was two things we really wanted to get out of that. One was to build this community, that network. So researchers like myself who are really interested in knowing what patients are experiencing, what community members are experiencing, and not us looking at data or making suggestions or coming up with our own ideas, but actually partnering and listening and talking and working together alongside patients and community members to solve, health issues. So we really wanted to build that network. At the time, we didn't know what that network was going to look like. The other thing is we have been doing research with the faith community here in UAMS for well over 20 years, even before I came here. But what I realized is we kept leaning on the same faith leaders over and over and over again, and we were really straining them. And so we really needed to build the capacity of other faith leaders within Arkansas to be able to partner in research, understand what research is, and then actually, be a part of what we were doing, and for us to learn, obviously, from them and their community as well. So the research, we not only help other people recruit and spread the word about the work that they're doing, but we also conduct some research as well. And our first was really to get an understanding of what faith leaders were experiencing across Arkansas. So we did interviews with a little over 50 faith leaders from across the state, just hey, how are you kind of managing as far as mitigating the spread of, COVID-19? Would you be interested in partnering to do a vaccination clinic? And what we really found is they needed just one place to go to get information. Because yet again, in the rural communities, we're having challenges to not only getting resources, but getting information and education to the community as well. And then honestly, from that, we developed a proposal to develop a COVID-19 concierge service. And I was actually approached by someone at Blue Cross Blue Shield saying, what are you guys doing around COVID? So we have our Faith Network Lunch and Learns, their webinars that we do every other month, providing information. And Right now, it's been a lot just COVID-related stuff, but we do provide other health information as well. So we've been doing that. We have our Stop the Spread distribution center. And so we have a partnership with Arkansas Department of Health, their Office of Faith-Based Outreach, and they provide us a mask. And so if any place of worship need masks, they can just put a request in, we'll mail them to them. We also have had funding and support through the Arkansas Medical Dental Pharmaceutical Association to purchase masks and hand sanitizer, and the Arkansas Minority Health Commission. And in addition to funding from PCORI, which is the Patient-Centered Outcomes Research Institute. And so through those funding streams, we've been able to set up this distribution center to provide that, along with the toolkits, which is the signs and things that people can put in within their places of worship. And then we have our e-newsletter that just gives updates about things that are within the community, education, different events as far as testing and vaccinations, those types of things as well. But I'm like, I want to do a concierge service. They're like, well, what is a concierge service? And I said, I want to be able to hire some community health workers, people that live within those communities that the pastors can call on. Be like, hey, we need some masks. Okay, I'll be able to connect you to that. Hey, we want to do a vaccination clinic at our church. Sure, well, I'll be able to connect you. And so just through conversations with Arkansas Blue Cross Blue Shield, we actually have received funding from Blue and You Foundation to do the service. And we actually have piloted it in Southeast Arkansas. And so we have 2 community health workers that are serving as concierges, who are basically helping pastors and faith leaders to do this outreach. And so they don't feel like they have to run around here and there and calling these different places. They actually have someone that can help coordinate whatever they want to do related to COVID. And so meeting and talking with the community members, we were talking about, everybody always talk about bad about the Delta, and that, there's no employment, there's poverty, these health issues, and blah, blah, blah. And I was like, we want to focus on something positive. What is positive that, what are the assets of this community? And he was like, look around, there's a church on like every other corner. And he was just like, you think about whatever community you go into, there's always a church or some type of place of worship. And when you talk about trusted places within communities, people go to church, they listen to the faith leader, they listen to their priest, they listen to their reverend or pastor, and they're trusted people. And when we talk about, too, ways to be able to reach people, because we're in the Bible Belt. And so it's like, if you don't go to church yourself, I always call it 1 degree of separation, you know somebody to go. And so being able to get the word out, not only to people who attend church, but just even their family, their friends, and community at large, that it was an asset to be able to actually work with the faith community. And so that actually sparked my work over 10 years ago now. And so we have the shared agenda. And it's not like me just trying to get something from them and them trying to get something from me, but actually saying, no, we're going to work in this together to improve the health of the congregation and the communities. I started off working in the African American community, but now we're working with every community that's interested. And the crazy thing about the pandemic, if health wasn't a concern of some of these places of worship before, it is now, because everybody is impacted by COVID-19 and having to make sure that they're keeping their congregation and their community safe.
Hello, my name is Ulysses Washington. I used to pastor Highland Valley United Methodist Church. I am now Central District Superintendent of the Arkansas Conference of the United Methodist Church. When COVID first started, I was anxious about getting the virus like most people were. I mean, I can envision back when March, when I first heard about it, the first response was we were engaged in ministries of exchanging pulpits and preaching. And when I first got word that one of the local churches was canceling, I thought, what the world? Why would they do that? And it wasn't until it was later on that day that I found that we had to cancel service at Highland Valley. So the response was like pretty much like most people, just wondering and worried about what this really was all about.
My name is Frederick Anthony, and I serve as the senior pastor of the Old St. Paul Missionary Baptist Church, and I've served in that capacity for the past 30 years. When COVID first hit, we did not really know that much about it. So we had to track it along with the CDC and the news agencies. And as it began to progress, we saw that it was a very serious virus and it was a contagious virus. So then we began to train our thoughts as we gathered more information about it.
Mi nombre es Alberto Alcacio, soy el pastor de Mosaico y el esposo de Esther. Bueno, realmente volvemos a lo mismo, no lo veía yo tan rudo, tan cruel, tan peligroso. Así es de que, pero obedecimos y le pedimos a la gente que no viniera a las reuniones, aunque las seguíamos teniendo casi a puerta cerrada. Y escuchábamos muy de lejos que una persona se había contagiado, no de la iglesia, sino del estado de Arkansas. Así es de que, y luego ya oíamos de 10, y así vimos cómo se fue aumentando cada día los contagios, hasta llegar a algún familiar de algún miembro de la iglesia. Entonces ya nos dimos cuenta que sí era peligroso y que sí era real.
When word of the pandemic came, I actually, as just a habit, I practice keep up with news quite closely. I read multiple newspapers online every day and, try to stay well informed on things. So as early as January of 2020, I was aware of what was going on. Right on through February, probably around the first Sunday of February, I actually began to give little short updates about COVID-19. We were calling it the coronavirus then. By the time we got into March, we were continuing these updates to our people. In fact, on March 11th, we have a midweek service, and before that service, I took about 15 minutes to just give my thoughts on where I thought this was going. In fact, to prepare our people that we might even not meet for a period of time if necessary, because this was going to be something that was very contagious, very serious. And by the conclusion of our service on March 11th, the NBA had shut down, several other things had happened. And so we were aware of it, and I was aware of it from early on. It was unknown, a lot of uncertainty, but aware that it was going to be a serious situation.
I was very concerned about my members getting the virus. I have individuals who work for the state of Arkansas and in more congregant settings where they work. Could easily get COVID-19. I have older members that could get COVID-19, and should they have gotten COVID-19, it may have led to their demise. So much so that I made sure that we reached out to these members and made sure they had everything they needed at home to make sure things were going pretty well. I didn't want people having to run out to do a lot of things and get COVID-19.
My thoughts and beliefs concerning my church members, primarily here at Bethel, we are an older congregation. We have about 50 on the roll, and about 25 to 30 may attend on Sundays, and the average age probably around 65. So my concerns was to make sure that the membership would be protected. And so we were strictly adhering to the requirements. Even my denomination, the AME Church, sent out a requirement guideline, things that we needed to do in order to get back in the church.
My thoughts about my members, very deeply concerned. We have a congregation that's older, and I always worry about our seasoned saints, as we call them, because they are skeptical and they have underlying conditions. Things just come with age, and it's always a concern because I was always worried if one of them contracted it, what would happen? As begin to see the other reports, and that right there weighed heavy on my heart every day. How will we avoid them contracting it? The more information we got and the more how it could be spread, it became a big concern because it was all about them.
And so I think it's important for us to partner as far as, researchers, the faith community, just organizations all together, and obviously us being at a public university, because trust is so important. And so one of my pastors told me, from the beginning, he was like, I don't like this term socially distanced. I don't want to be socially distanced from my congregation, from my community. He was like, let's call it physically distanced. And so from that conversation was just like, okay, how can we actually have the doors open, but not physically? How can we make sure we're still engaging people? And so that was when we came up with our idea of doing a toolkit for places of worship. And so the toolkit actually includes ways to keep engaged, but do it safely. And so we talk about doing services outside and then, physically distancing. We talked about how to use Zoom and how to use YouTube and all these different other, platforms that we could use to stay engaged. People were doing drive-bys, checking on people. And so all those different recommendations, it wasn't us coming up with them. It was us actually talking to each other, as far as within the Faith Network, okay, what do we need to include on this? But also the toolkit included for those who still wanted to meet within their place of worship or their church and want to do it safely, want to make sure they had signage that talked about the symptoms of COVID-19, to have signs about how to wash your hands properly, about wearing a mask and all those different things, and actually supplying masks and hand sanitizer so they could meet safely. And we've been working very closely with the Arkansas Department of Health Office of Faith-Based Outreach. And so everything that the health department has been recommending, we've been right there with that office to actually make the materials that we've been sending out. And so that they came out with their recommendations. We just made it a little cuter and made it a little bit, we have our Center for Health Literacy here on campus. And so making sure that readability as well. And you have the bullet points so people could just look at it, figure out what they needed to do. And so we work closely with that office over at ADH to make sure that the information that we're providing is consistent with what the Arkansas Department of Health is saying.
I feel my greatest challenges is trying to lead the congregation during this time, was trying to keep everybody connected. We've always gathered on our Wednesdays and our Sundays, Sunday school, Sunday worship. Trying to keep everybody connected was the most difficult part. Trying to make sure everybody's equipment was up to date. We even had to upgrade our own equipment. Unfortunately, in rural area, the internet was not always good. It was not strong. We was doing our internet, the signal was so weak, it would be going and just drop out. So we had to change that to get a stronger signal. Had to reconnect, and he had to reprogram everything, and trying to keep in touch with people, because our people, in spite of what was going on, they still had concerns, they still had needs that had to be met, and they still look for the church to be able to fill that, and looking for information, and we basically to give out information, but you had to be connected to people.
And so what we began to do then was to come in and get people who were skillful at working with equipment and platforms, and open up platforms, and we had to spend some money to get some of those things done so that we could get the word out, so that we could continue to communicate. And then the Keep in Touch ministry, they just got out there and they just started calling people and giving reports as to how they were and what they needed and what we could do to assist them.
One of the things in the AME Church, in the Methodist Church, we have a hierarchy which has a bishop. Well, one of the things that our bishop did was starting in, I think it was March, maybe even April, that we started doing online with our entire Episcopal district, which includes Arkansas and Oklahoma, that people were able to call in. So on Sunday mornings, the members all over could call in and receive a message. And so that helped set the stage for this particular congregation, but also there were some that were doing Facebook Live. There were others that used their web page. So it helped with the leadership setting this standard.
So the pandemic caused us to change how we do Sundays and
every other day of the week. We have gone to fully virtual. We've been there since March 15th of 2020, and we've stayed virtual all this time. So that is certainly a significant change. It's caused us to have to speak to the virtual audience. I've had to learn how to preach to a camera rather than preach to people, and teach to a camera rather than teach and see faces.
When we were making changes, first of all, we didn't want to make change for change's sake, but we wanted to be ready to make change, and we have not been afraid to make change. There's some things we've done here in worship and in our ministry in years gone by that was unorthodox, as far as we didn't know of any other church family that was doing something maybe the way that we were, but I felt led that it would be best for our membership to do it. So when COVID came and we began looking at how we could best adapt and how we could adopt and do whatever, not only was I visiting with other pastors and keeping up with what other ministries were doing, but I had several of our people, again, had great ideas.
At a point, we reached that point in time to where we started equipping the church better with hand sanitizers and with face masks. We had this wonderful group of ladies at the church who made several hundreds, if not thousands, face masks. Having those where people could get to them, signage at the church, which doors, when we did come back to a point of being in-person worship, we had to have signage of how to enter, where to enter, spacing of seating in the sanctuary, and how to exit the community. It had those kind of impacts.
But what we had to do when we opened the church up for in-person worship is to put quite a few procedures in place. That is to say, the person comes in church, their temperature is checked, hand sanitizer is present, they answer a series of 6 questions related to exposure and things like that. That's recorded every Sunday. They sign a form still today. We also now record whether they have received their vaccines or not. And part of the purpose of that is really, I ask if they've received it, because if they haven't, I'm going to go to the person and ask if they have any questions about getting vaccinated. Are they having trouble getting their vaccine? I want to do everything I can to remove all the stumbling blocks for a person's way.
We had to consider how we interacted and how we communicated, so that as the leading communicator in the church, that there had to be some trust, there had to be some reliability, there had to be some carefulness on the information that I gave, and particularly the judgment maybe for people regarding people's decision. So that they will know that I would be basically informed. I was in the know. I considered documentation and records and information that lined up with what some of the things that they were hearing. I had to trust them to trust me. And so because of our relationship and some of the other programs with the UAMS, we were able to have access to some of the things we needed. Sanitizer, that was difficult at the beginning to acquire, all the shelves empty, but we were still able to access some sanitizer and make it available. We had the posters and the directives and all the stuff, flyers that gave our requirements for entering, social distancing, wearing your mask, taking the temperature. All of those things were important.
And I really love that people were reaching out asking what they can do to help and willing to help each other. Because one of the things that we've been hearing, because we did some listening sessions around resilience and just how do we support our neighbor? How do we get through this? And a lot of it was just basic needs. You know, when everything was shut down initially and people, you know, financially were strapped because the restaurants were closed, the barbershops and beauty shops, all these different things, people could not work. And the faith community stepped up and was just like, we're here to not only minister people, but we're also here to make sure their basic needs are met. And just hearing that was just heartwarming, really. Making sure people, are getting the food that they need, getting transportation, getting the clothing they need, all those things. The faith community really has stepped in and has really, I think, shined pretty bright about it. Yeah.
Yes, I perceive that particularly the black pastor, the African American pastor, we actually pastor our community and not just the congregation. And so with that, COVID played a strong role in us solidifying to be able to respond to our parishioners, to the need of our community. And so we came together, made donations from our churches to make sure that our people had food, make sure they had necessities, that they were taken care of. We gave out gas cards and food vouchers, and we work with the DHS and with the grocery stores and established here as a pastor of that kind of a solidification of pastors, not so much formally, but basically based on the need and how we could collectively meet the need of our community and take the pressure off just one or two who are capable of those who may not have been able. So I think that COVID was a blessing in that we were forced to kind of work together and not be so centered on how things were faring with us.
So when the pandemic hit, our elders and I in prayer felt it was wise for us to and our responsibility to help our community financially. So as you said, people lost jobs, businesses were struggling because they were told they had to shut down, barbers and beauticians. I got a slew of those folks in St. Mark. So we started what we called the Restoration Project. And the Restoration Project was encouraging our members to just do what they always do, give their regular tithe and their regular offering. And we took 10% of that and gave it out in restoration grants to households that were struggling or lost wages or hours because of the pandemic, and businesses as well. And so we were able to touch a lot of people locally and a few people outside of our local area. Those who applied for restoration grants, we gave over $250,000 out to the community to ensure that people who were struggling felt the touch of God and felt the help of God. What also came out of that is not just giving people checks, but also giving people hope and connecting them to resources. Some people didn't know how to access unemployment. They didn't know how to access PPP for their businesses, and we were able to help guide some people in those ways to things that sustain them long term and even set them forward in their business or their household. So that was an encouraging part of our journey last year.
Yes, I have few members that we help out during the pandemic. We did help them with groceries, foods, and also rental assistance, utilities. So these were the kind of assistance that it was needed. So we step in and help them during that time.
If you had this partnership, this trust, this relationship at the beginning, maybe we could have avoided some of this. And so but that also requires time, that also requires resources, and it requires commitment. And whatever institution it is that actually, wants to engage the faith community, they have to be willing to do that.
But I think there are some residual things that we've learned through COVID that can be carried over into other traumatic situations.
But I've really learned by experience, and that is there's no such thing as over-communication.
So the pandemic taught us that when it's come to the relationship of the people with the Lord, it is important that they keep their personal relationship with the Lord.
I've learned to make us aware that crisis can occur at any time. And so let us not consider just a pandemic.
Pero nosotros hemos aprendido y seguimos luchando para que otros aprendan, para estar preparados para cualquier cosa que pueda venir. No somos fuertes, somos débiles, pero tenemos un Dios fuerte que está con nosotros.
Many people say, well, they take you to 2 Chronicles 7:14. If my people who are called by my name would humble themselves and pray, seek my face, turn from their wicked ways, then will I hear from heaven, forgive their sins, and heal the land.
There needs to be some procedures and things in place such that if these things happen, we'll automatically click in this and will not have to close church.
So what this really has taught me is to do what God said to do, is to be all things to all men, if at all possible, to love God with all your heart, your soul, your mind, and your strength. Love your neighbors, you love yourself. But first, you have to really love yourself if you're going to love your neighbor.
I've learned most of all just to personally on a spiritual level to maintain my integrity in my relationship with the Lord, to not let the fear of man be a snare, not to be overly sensitive to people's opinions or whether they think you're doing a great job or an awful job, but just remain steady to do the best that you can.
I have learned to be on top of things that we used to kind of brush off. And it has taught me to be on guard, to adhere to the information, even though I stay in my word, but I also watch the television to see what's coming around, see where things are.
God is still in control. Whatever we go through, He knows what He's gonna do. Sometimes we question Him, but He already knows because He's the beginning and the end. He knows everything before we ask Him.
And so moving forward, I hope organizations like even UAMS, we continue to have that commitment to continue to build that trust, to continue to engage the community way past the pandemic.